Hi, and welcome back to the second of several videos concerning the ankle and ankle injury. What I have for you here is a live ankle with a model, and I want to show you some of the things that we do specifically during our evaluation of an ankle injury. And so obviously, going back a few modules, I would start with my primary survey. And with a lower extremity, your primary survey is going to consist of making sure that they have an airway, breathing, and circulation. But those are pretty much identified as intact when you approach a lower extremity injury, because they will be up and they'll kind of be clutching that ankle and kind of screaming and yelling and letting you know that all those things are there. But still, I will want to make sure that the head and the neck are okay, especially if I'm working with a football or basketball or other collision or contact sport. But as I approach them, I will quickly identify just by their manners and their posture that they have an ankle or foot injury. And so I can kind of get to that pretty quick. And so once I do, then I'll start my secondary survey, and that is history, observation, palpation, and stress or special test. One of the things that I'll do as soon as I can is I'll want to rule out dislocation and fracture of the ankle. And if you go out into the module and you saw that picture at the top of the module of the football player, that's the guy who had a dislocated ankle. And so they're pretty easy to pick up, but you're looking for deformity. You don't always identify the deformity of all dislocated ankles, but most you can. Also, in that same respect, I'm kind of trying to identify if maybe there's a fracture of the lower leg by looking for deformity there. Many times that lower leg will have a strong deformity, possibly even a compound or open fracture where the tibia is coming through the skin. And when that happens, you're looking for that strong deformity where the ankle just frankly doesn't look like it's supposed to. And so as I approach that, and I'm taking my primary survey in, and then I'm doing my secondary survey, I'm going to start asking questions. I'm going to say, how did this happen? What happened? What do you remember about the injury? Has it ever happened before? I'm looking for those people who tell me that yes, it has happened before, that they have a previous injury, especially on that side, because those are the people who can typically identify very quickly what it is that's happened this time. They can say, I rolled my ankle, I sprained my ankle, I turned my ankle, and those are the kind of the common remarks that I'll get. But what I do is, with my history, is I begin to develop my foundation for my assessment. And as I identify certain variables, then I can start to understand where I need to give most of my time. So the next thing I'm going to do is I'm going to go into my observation. Well, remember, if you see deformity, there's a dislocation or a fracture. Another thing that you're going to look for, though, is swelling. And swelling is many times thought of as a deformity, but swelling is a natural occurrence. Remember, going through acute inflammation, and we're going to see it happen quite rapidly. There have been a number of ankles that I have literally taken care of within seconds of the injury, and the amount of swelling is incredible to see how fast it happens. But we can see that, and then we know that there is something occurring or something going wrong in that area because the swelling tells us so. So that's part of our observation. The third part is our palpation, and that's us feeling of the injury, which this gives us a lot of information too. You're only as good at palpating as you are at knowing the anatomy. And so I've kind of drawn on this model here some identifiers that I want to kind of give some attention to. And this is kind of where we're going to start. So as I begin to palpate, the first thing I always do is I just kind of come down that ankle and I just kind of stress and press on that fibula. And what that does is that tells me really quick if there's going to be a risk of fracture. Remember, in the previous video, we talked about the Ottawa ankle rules. They're still behind me, but the distal 6 centimeters here will show point tenderness. And as I approach that, I will definitely give that the proper attention by pressing on it to elicit point tenderness. But what I'm doing here is I'm kind of spaying that and trying to push and press to get some distal referred pain, and that way that indicates to me whether or not that joint, or I'm sorry, that bone is opening up a fracture by squeezing it up high. And so I'll start that way. And as I get down, I will kind of give that lateral malleolus or fibular malleolus some attention, and then I come over here on this inside and I'll do the same. But again, I'm giving most of that to that distal 6 centimeters. Why? Because Ottawa tells me that that's where I need to be giving my attention to. The next thing I'm going to do is I'm going to come down here to this 5th base of the metatarsal, or base of the 5th metatarsal, and I'm going to press and I'm going to try to manipulate that. Now, if you feel that crack or creak or pop, then chances are there's a fracture, and definitely you want to get that looked at with radiographs. But usually if it's broke, the times that you start pushing on that little hook right there, they're going to let you know about it really quick. And then third, I'm going to go up here to my navicular and I'm going to press on it. Now again, that's a medial bone, and as I externally rotate my model's leg, you can see how I've denoted that medial bone, but it's right there. And so let's look at that inversion process coming over, and what you can see is some of his muscles start to stretch and some of the tendons in there. But as that happens, that navicular is compressed. It's compressed between the tibia and the other foot bones, and when that happens, that's what causes a fracture risk in that navicular bone. The next thing is this over here gets stretched, right? So remember from that first video, here is our anterior talofibular ligament. I'm going to check point tenderness by palpating it. And again, I've got to know my anatomy, so I come up here and I just kind of want to dorsiflex that foot a little bit, and then I press in. That way I can really get an identifiable palpation on that anterior talofibular. Then I'm going to come down here to my calcaneofibular ligament, and then over to my posterior talofibular ligament. And if all that checks out, and I can usually elicit some pain with my palpation right there, and I'm going to identify some point tenderness. But then the next thing I'm going to do is I'm going to go to my special test. Now what that looks like is this. I'm going to first do a talar tilt. Remember, the talus sits right here in the middle of the joint, and I'm going to take and stress that. And what you can actually see is some of the tendons and possibly even some of this calcaneofibular ligament popping out right there. And what I'm doing is I'm stressing that, and the only way I can identify if that's loose or unstable is if I were to take his good leg and bring it in the equation too. So I have to check out good leg, and then I have to come in and check out bad leg. But as I stress that, I can identify if there is any laxity in that ligament just by pulling on it. The next thing I'm going to do is I'm going to do an anterior drawer. And the anterior drawer test, and I'm going to go out of view just for a minute here, but the anterior drawer test literally is just like opening a drawer. And what I'm doing is I'm stabilizing with my left hand here over his lower leg, and then I'm pulling on that ankle. And I can even identify in my model that there is probably just a little bit of arthritis beginning in that joint because I can just feel it. But what I'm doing is I'm literally trying to open that drawer by pulling this way. And if they have a pretty open or unstable joint, that joint will literally pull forward quite a bit. So there's my history, there's my observation, there's my palpation, and there's my special test. In the next video below, log in and look and see us tape this ankle, and we will talk about why and how to tape, as well as why and when to brace. See you on the next video.